So for the next few minutes, we're going to talk about a little bit about things that you know about fire prevention and what to do in case there's a fire in the hospital, because you've seen that through some of your orientation and compliance modules. The other thing we're going to do is we're going to talk about how to prevent some falls while we're in the hospital. So fires are a big issue in a hospital. They're a big threat. There are a lot of flammable chemicals in a hospital, oxygen, the whole nine yards. You've all seen it. You know about it. So what's really important is how you respond. So when you respond to a fire, we use the RACE acronym, which stands for Rescue, Activate, Confine, and Extinguish. So the first stage when you realize that there's a fire somewhere is remove the client or anyone else there from immediate danger, move them into the corridor, and close the door to the affected area. Activate the alarm, pull it, call it, however that might be. And then we want to confine the fire by closing the doors and the windows, turning off all the oxygen valves in the area. And then we want to extinguish the fire using a pass method called pull, aim, squeeze, um, and sweep. So some of this happens very simultaneously. If you come across and you realize a fire, one of the first things you're going to do is you're going to yell for help. And while you're going in to get that person, someone hopefully is going to realize that there's a fire and they're going to activate the alarm system. By activating an alarm system, any automatic or magnetic door is going to close, and the only way it will stay open is for you to physically hold it open. Oxygen valves is another story. You have to be taught how to turn those on and off. Only certain people can do it. Blah blah blah, and it has to be done because oxygen will fuel a fire. Okay, and then using a fire extinguisher is you pull the pin, you aim the hose at the base of the fire, you squeeze the handle, and you sweep from side to side. I will say, don't attempt to put out a fire that you don't think that you can control. It's best to confine it, close the door, and evacuate. In a hospital, we evacuate from side to side laterally before we go up or down. You always wait on someone from the fire department or someone who has that type of responsibility, and that might be you, to decide to move up or down a floor. So next we talk about preventing falls, and this is pretty straightforward, and it's off of table 24-4 in your text, and I don't remember exactly what book or what page that is. But determine the appropriate side rails for your client. Do they need any side rails? I would say yes. Put the top two up, one that helps them maneuver in the bed. Put a third up if you think it'll help, but actually they can, as you saw earlier in one of those photos, side rails can be a deterrent actually. Keep the bed locked. The wheels on the bed either lock individually or there's a pedal that locks all 4 or 6 wheels at one time. Just make sure that it's locked in and that it's in its lowest position to the floor. So if you're working with the patient, bathing them, putting in a catheter, starting an IV, or whatever it is that you end up doing, it's okay to raise the bed up to your work pattern so that you don't hurt your back. But when you're done, it's really important to move the bed back down to its lowest position. If your person is in a wheelchair, make sure that the wheels are locked when you stop it. Okay. If your person's bedridden, keep their water, their bedpan, or their urinal tissues, anything that they use frequently within their reach so that it's easy access. Put their call bell within reach, make sure they know how to use it. Provide a night light. Sometimes that's just the bathroom with the door cracked. Some hospital rooms actually have a built-in night light somewhere on the base of the floor, somewhere along the way. Keep the floors dry and free of clutter. Make sure that there's a path to the bathroom if your person is mobile, okay, and that stuff's out of the way. Put a sign on the door above the bed that the patient's at risk for falls. Orient the client to the surroundings. This is where the bathroom is. It's to your right side. Here's your bedside commode, whatever. Offer assistance going to the bathroom or moving them around the bed frequently. People often are trying to get out of the bed because they need to go to the bathroom or they're just uncomfortable in the bed. Okay. Educate the family and the client about fall prevention, what keeps them from falling, those kinds of things, and to encourage the family and the patient to call the staff when they want to get up for whatever reason. Consider using hourly rounding as an intervention and as a tool here. Oftentimes, if you're in a very large unit and you've got 2 or 3 nurse aides, 1 or 2 of them might be assigned on the odd and the even hours, respectively, to go from room to room to room, offering water, the opportunity to go to the restroom, opportunity to be repositioned, and so forth and so on. This will decrease the patient's need or desire to get up. I don't like number 14, but it still shows up from time to time to place your confused or disoriented clients close to the nurse's station. There's a couple things wrong with this. So many of our patients are disoriented and don't know where they are that there are only so many rooms close to the nurse's station. The other thing that's wrong with this is if you've ever been into a hospital, regardless of your role, you'll notice that there aren't always a lot of people at the nurse's station. So it's sort of a defunct methodology, but sometimes you have the opportunity. Have patients who are at risk for falls to wear the specific colored non-skin socks to alert caregivers. So I think some facilities are this bright yellow or bright purple, and they've got this sticky stuff on the bottom of them, and you know the person's at risk for fall. Communicate that someone's at risk for fall during your shift report, and document any kind of changes that you might see or have with the patient's condition so that your colleagues know what's happening.